Go ahead.
I'm Mrs. Fan Kasaro Mumba. I stay here in Luapula province and I'm found in cancer department, which is based on Mansa General Hospital. Only 2 of us were trained and 1 helper is helping us. So the state of cervical cancer in Luapula province is fast. But the problem that we are facing is how to get them. Sensitization we've been doing since Mansa itself is small. Yeah, some few have come, but we've been trying to reach out to Mansa, the outstretched of Luapula province. They are willing, but they can't manage since people look to be in the state of poverty. So it's very difficult to come on their own here. And then when you look at the state itself, the status of cancer, a lot of people, they are positive with it. The only lamentation that we have is they come in the late stage. They have no option but to come at that time. So that's the state of cancer. When we had an outreach in December, we went to Chiengi district. We had captured a lot of women, of which about 66 of them were positive. And most of them, lip was done and the results are in. And a lot of them, they have these cells. So thank God that we followed them up. They made an effort. They gave us transport. We followed them up and we treated them. So a lot of people, we haven't reached them. Now, if you look at Luapula province is the place where a lot of people come to buy fish. So it's a state that it's a place that has a lot of people who come from different places. So when you look at the moral state, the moral is not good because a lot of fishermen, they have a lot of women. And due to that, the circulation of these cells, cancer cells, they're circulating from one woman to another, one woman to another. That's the state of cancer in Luapula province. But if only we can have a way of reaching out to them, like instead of waiting for the mobile hospital, because we've been incorporated in mobile hospital. So far, we have only traveled once. So even if we are incorporated in that, if we can have our own transport, that we can be making arrangements to reach out to them, it can help a lot of women in Luapula. They are very much willing, but how to reach the station.
Okay. Do you have statistics of when, first of all, when was this center opened and how many people have been screened so far?
This center we started on 14th May.
Which year?
2013. And up to date, so far we have screened about we have screened about 1,846.
Okay.
Yes.
And how many were positive from that number?
On that number, we have so from 14th May to December, the annual report that I compiled, I have discovered that we have 286 which were VIA positive. And then out of those, they were at least, we had a breakdown. We brought them down to, out of 286, only 135 we did cryos. The referrals were about 151. Then, from the breakdown of the referrals, those are the people that we can't do cryos. It's beyond us. So we referred them to the doctor, of which their breakdown was, out of 151, 67 lip was done on them, and then 20 biopsy was done, and then 64 was just treated. So that's the state.
Okay. And what are the referral? When you refer, where do you take the? Is it to Lusaka or within the hospital?
It's within the hospital. First, when they reach us as nurses. Mm-hmm. When we can't do it is beyond us, we refer them to the doctors from within the hospital. Okay. Then the doctor will decide whether to do lip or to take a biopsy.
Okay.
Like in case of query ICC, those we are already querying cancer of the cervix, they take a biopsy straight away. And then those that they can be treatable, they do lip. But those, when the results come, there is further referrals. Those who are query ICC, if they come positive cancer, then we refer them to Lusaka.
Okay. All right. Now